Hello, hi everyone. I hope all of you doing well. So in today's lecture, we're gonna talk about schistosomiasis. Okay, what is schistosomiasis? Let me break this word into two: schistosoma and iasis. Iasis means infection, and schistosoma is the cause of this infection. The cause of this infection called schistosoma, which is a parasite or a trematode. We can say also it's a blood fluke. Blood fluke means, I guess, it sucks the blood. I guess that, I don't know. Anyways, schistosoma has many species, or three species in basically. The very first one is Schistosoma haematobium. So this type of schistosoma can affect the urinary tract, bladder, urethra, and all the urinary tract. Can cause also a bleeding during peeing. The patient will be peeing literally a blood like this. Assume it's a urine. Okay, urine drops. So the patient will pee blood. Okay. Also, it can cause increases risk of squamous cell carcinoma of of the bladder. Okay, it can cause squamous cell carcinoma in the bladder. Keep that in your mind. The second type is called Schistosoma mannsoni, affects the intestinal and portal vein, where the first one, what we say, was its name? I forgot. Yeah, haematobium affects or infects the urinary tract. Mannsoni affects the intestinal and portal veins. Okay, put your put it in your mind. As long as it affects the portal vein, it can also affect the liver. Okay, put that in your mind. That's why schistosoma can really cause liquefactive abscess or something like this, but it can cause a liver infection actually. Okay, causes periportal fibrosis. Yeah, it can cause portal fibrosis, so it will increase that hypertension or the pressure in the portal veins, so it can lead into cirrhosis and also can lead into esophageal varices. So I guess this type or this species is much more dangerous than no, they both are dangerous, because the first one complication was squamous cell carcinoma and the other one is cirrhosis. They are like both has a a danger stage. Okay. Schistosoma japonicum, japonicum, I guess it is spelled japonicum, not japonicum. Okay, similar to Mannsoni, it also affects the small intestine and portal vein, and often more severe. Okay, this is the most severe in between the remain. Okay, because what it can cause, it can also involve the brain. It can cause brain abscess. Okay, let me explain the life cycle. Okay, these are eggs, the schistosoma eggs being released by the mother. I don't know how to draw it, but I assume it's the schistosoma. Schistosomia. Let us call her schistosomia. Okay, so Mrs. Schistosomia release eggs. Okay, so depending on the type, the first one, haematobium, will be released in the urine. Okay, and the urine of who? Of the patient or the carrier. So this carrier can really carry the disease or schistosomiasis into to other person. Okay, urine when it's hematobium, and in stool when we talking about jabonicum and the Manasoni or Mansoni. Okay, in the fresh water they infect us. The snail, you know the snail, right? The snail is the reservoir or the carrier, the main carrier. So this can um, carry it into a person, so and also to another person. Snail release Cercariae infective form. Cercariae then penetrate human skin during freshwater exposure, like in water in the lake. You know, this is water. Oh, should be blue. Oh, sorry. Should be blue. Okay. This is like a lake, and fresh water is this. As someone is came and washed his face with this, what he brings and washed his face with this water, and then, but luckily there was a carrier or reservoir snail was in this lake. So what will happen to this person? He will be a carrier. He will be a pathogenic person. Okay, he will carry the schistosomiasis. Okay, they migrate to blood vessels. So as we said, the eggs being released whether in urine or in colon or anywhere else. So just um, when the snail released the cercariae, which is the infective form, the cercariae penetrates the human skin directly during freshwater exposure. Okay, they migrate to blood when they exposed, they will penetrate. The human skin. They can penetrate the human skin. Can you understand that? Then they will migrate to blood vessels and mature. What? And mature into adults. I don't know. Early swimmers, itchy rash skin injury side. This person will feel itchiness or pruritus, skin injury side. Okay, Katayama fever eosinophilic, blah 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 blah. Hematuria is a really very clinical picture or clinical, how we can say, okay, clinical picture. Hematuria, portal hypertension, or splenomegaly. Why splenomegaly? Because the blood will be trapped in the branches of the portal vein. Let us stay the pathogenesis. The eggs cause most of the damage. They are the devil here, not the adult worms. Adult worms can be infective. Infective are the eggs, okay? Or cercariae. We call them cercariae. Okay, leads into fibrosis. The egg trigger granulomatous inflammation with eosinophil. This causes or leads to fibrosis. How we could diagnose it? We could diagnose it with hematobium, terminal spine, lateral spine, Mansoni. Treatment parasequental is the drug of choice. We can give them also albendazole, but the drug of choice here is the parasequental. Okay, so you will choose this all the time. Parasequental. Okay, high yield memory lines, snail, skin penetration, blood vessels, it causes fibrosis. and good luck.